Hello, everyone. So today I'm going to present our team's journey, thinking about creating something new. And finally, we created and planned an innovative lipid project for the patients with high cardiovascular risk. The aim of this project is to assess the current lipid management in patients with established cardiovascular disease, identify areas for improvement between current lipid management and best practice from guidelines and the newly developed lipid pathways, and finally, to provide evidence to support the implementation of the proposed Cheshire and Merseyside lipid management pathway. This project gave us an opportunity to imagine digital innovation in lipid management in patients with high cardiovascular risk, creating an innovative lipid pathway for these patients, and finally, inspiring and motivating our team in creating an innovative practice in the delivery of lipid service for the local population. The preliminary lipid data from our local population set out an idea for transforming the lipid care for our patients, which could have been achieved only by motivating and inspiring our staff in planning and designing, and also identifying the needs of our patients. So we as a team reflected together upon the past and the present and planned the future of our lipid care for our population. In the past, there has been one size which fits all for the lipid management. So what does that mean? That means that the patients have been referred from the primary care to the secondary care, and patients, they will attend the phlebotomy to give the lipid sample before attending our lipid clinics in the secondary care. And finally, the patient gets treated and monitored and the follow-up of the lipid management in the secondary care. At present, the service has been distributed between the primary and the secondary care. The primary care will refer only the complex lipid patients or patients who are intolerant to statins to the secondary care. Therefore, we thought that in future, what we need is a digital lipid integrated care pathways, which integrates the primary with the secondary care through one-stop treatment clinics, virtual clinics, introducing the lipid meter as a point of care testing for the lipid clinics, and the lipid healthcare app for the patients. Progress is impossible without a change. And if we have to bring a change, we have to think out of the box. And that is what we did. We all thought of bringing a change in the lipid management. So we decided that what should be the vision of this project? The vision is to improve the lipid health outcome for our local population. The mission is to deliver the value to patients with high cardiovascular risk and introducing the digital strategy to innovate the lipid pathway. So this innovative lipid pathway was aligned to 4 strategic initiatives, which included reducing the cardiovascular morbidity in patients, motivating the staff to facilitate the innovation, and exploring changes in the lipid pathway, and finally, improving the efficiency. With this in mind, we set out the objectives for our lipid innovation project. And these are lipid healthcare app for patients, engaging the staff in creating innovation, using the point of care testing for the lipid test, integrating the lipid management between the primary and the secondary care through the virtual multidisciplinary team meetings. The journey of this interesting and exciting lipid pathway is only possible if we have an inspired and motivated team. And that is what we did. So our team worked together to start this journey of lipid management or creating a lipid pathway. So this is the roadmap of our lipid innovation project, which started in December 2019, when the Liverpool Lipid Transformation Project, sponsored by the Innovation Agency, was approved. In January 2020, we received the funding for this project for 1 year. In February 2020, we created our team of healthcare professionals, which included the nurses, pharmacists, doctors, and managers. We started thinking how to design and implement and plan the lipid pathway for our population. However, in April 2020, we had to stop the project and we could not initiate this project because of the COVID pandemic. But slowly we recovered and we restarted our project in October 2020 by arranging a training day for our nurses. We started thinking about data collection, designing the lipid pathway, and also designing the lipid passport for our patients. And in the 1 year time, which started from October 2020 to November 2021, we were able to achieve a lot of our objectives, where we introduced the lipid clinics, lipid meter, lipid data collection, and the lipid passports. The national guidance of lipid management in primary and secondary prevention for cardiovascular disease was introduced in 2020. And this is the framework of our lipid pathway. This guideline gives the healthcare staff an explicit advice on managing the patients with the high cardiovascular risk, how to manage their lipids. Besides this, it also gives a very clear algorithm of managing the patients who have statin intolerance. Such patients who are intolerant to statins can be considered for bempedoic acid or for injectable therapies such as PCSK9 inhibitor and inclisiran. So the lipid pathway aim was to integrate the primary with the secondary care. So we have two work streams. The secondary care work stream, we chose Cardiac Rehab Center from Liverpool Heart and Chest as the center for the secondary project. For the primary work stream, we chose Ainsdale Medical Practice, and the lipid data was collected from both the primary and the secondary care work stream by our nurses. The patients who were not on statins were started on statins. The patients who were already on statins and not achieving their targets, they were either their dose of statin was increased or they were started on ezetimibe along with the statin. And these patients have been monitored in this lipid clinic every 3 monthly. Patients who have responded to the treatment are discharged back to the clinicians, and patients who are not achieving the targets or are intolerant to statins, they are then referred to the lipid MDT group. The lipid MDT group comprises of lipidologist, cardiologist, GP, staff nurses, and pharmacist. And this lipid MDT group will review the patient's clinical history and the lipid history and then decide what further treatment is required to achieve their lipid targets. And this can be bempedoic acid or inclisiran or PCSK9 inhibitor. If the patient goes on bempedoic acid, then they are sent back to the lipid clinic. But if the patient is going to go on PCSK9 inhibitor, and in future we will be including the inclisiran as well, this patient will be referred to the lipid specialist clinic. The lipid specialist clinic is being led by the pharmacist, supported by the lipidologist. So the patient will be commenced on PCSK9 inhibitor and the treatment will be monitored every 3 to 6 monthly. So during this patient journey of lipid pathway, what the patient is getting. So the patient will come to the lipid clinic and will give the blood sample, which is a finger prick sample at the same time. So you get the results, the nurse will review the results and will review the treatment. At the same time, in the lipid clinic, we also give lifestyle advice, which is very crucial for the patient. We also give them the leaflets on lifestyle advice, and we also direct them to the lifestyle advice websites. We also created the lipid passport. The purpose of the lipid passport is to create awareness among patients about their lipid management, and at the same time, empowering them to monitor their own lipid targets. And this is the lipid passport, which you can see here, which we introduced. This is a copy of the lipid passport. And the lipid passport is given to the patients in the lipid clinic. Their lipid value is entered in the lipid passport. The staff will explain that this is your target for the for your cardiovascular disease, and this is your LDL cholesterol or non-HDL cholesterol target to be achieved if you do not want any further cardiovascular events. And the patient is encouraged to bring the lipid passport every time they come to the lipid clinic, or anytime if they get any lipid results. We also introduced an artificial intelligence of data collection by Dontex. Now, this is a very useful app which is linked to the hospital patient electronic system, and this guides our staff in collecting the patient's lipid history while they are doing the consultation. At the same time, it also guides them and directs them to an appropriate lipid management by asking questions. So this is a very useful data collection app which has helped in improving the staff experience in managing the lipids in our patients. Reflecting on the lipid pathway has been really helpful in planning, designing, and implementing the lipid pathway. So we reflected on our barriers. So the biggest barrier has been the COVID or the pandemic, which delayed the initiation of this project by almost a year. Limited funding for 1 year. Initially, we did have problem in getting data collection has been a laborious procedure for our staff. We did have some delay in implementing the digital data collection app, trying to get help from our hospital IT system. And finally, patient attendance has not been great in the beginning because of the COVID. However, we did have a brilliant team who is highly motivated, inspired, and they've continuously worked in implementing and bringing the changes in the lipid management. We are very thankful to the Innovation Agency to sponsor this project, as well as giving us all the support all the time. We are also thankful to the cardiac rehab, to Professor Fisher and their cardiac rehab team from Liverpool Heart and Chest. We are thankful to Dr. Bennett from the Ainsdale Medical Center, who offered their sites to be the part of the study. We are thankful to Dontex for bringing the digital lab app for the data collection. And more important is the shared decision making by our team, which brought a lot of changes. And more importantly, our patients, for whom we tried to set up this lipid pathway. Nevertheless, we have challenges on the way. In the form of implementing empowering our staff in creating and thinking and bringing innovation and changes in the lipid pathway, and more importantly, the funding to continue with this work. To summarize, we started this project in 2019 by imagining the lipid innovation. When our project was sponsored by the Innovation Agency, defining the vision for the project, creating a team which could design the lipid pathway, giving a timeline to this project, and motivating our team to work on this project. In 2021, we created innovation through our strategic direction, commitment from our team, collaboration from our senior management teams, and building our team effectiveness, empowering the team members to create innovation. In 2022, we aim to embed the lipid pathway by empowering the patients in their lipid management through digital lipid passports, digital lifestyle awareness, improving our staff experience by introducing one-stop lipid treatment clinics, introducing the artificial intelligence for data collection, and finally, integrating the primary and secondary lipid care approach through the lipid specialist treatment clinics and the lipid case MDTs. In the end, I would like to acknowledge all the teams for all their support. Without their help, we would not have been able to achieve a change which we have brought into the lipid pathway and the lipid management for our patients. Thank you very much.